things have gotten out of control. And I'll tell you, whenever I've posted some evidence of this, I get bullied online, because it's basically become a parenting cult of people who need to believe that their child has this diagnosis, and they rationalize, their child's behaviors through this lens that has no evidence-based treatments, has no standardized diagnostic tools, and is not a recognized diagnosis anywhere in the world, even though they like to say it is. So, yeah.
Welcome to the Reality Therapy Podcast, where the truth will set you free.
Hello, here I am with Ryan Wexelblatt, a licensed clinical social worker who predominantly works with parents. I'm so glad to have you on. Thanks for coming, Ryan.
Yeah, thanks for having me. I appreciate it.
So I want to start with a little background biographical information. What motivated you to get into the helping and mental health profession and field?
Yeah, so I guess I realized when I was, in undergrad that I was pretty good at working with kids and trying to decide what direction to go with that. I decided, based on some advice, to go, the mental health route. I had a lot of therapy myself as a kid and young adult, and a lot of it was not helpful, but some of it was helpful. So I always just felt kind of affinity for going in that direction. So that led me to get my MSW, or as I call it, the most expensive mistake of my life.
Well, why do you call it an expensive mistake?
Because I think from from the perspective of looking at your student loans versus how much you're going to make, it's not necessarily going into a mental health profession. If somebody loves it and they're passionate about it, great, but you have to go into it knowing that, you're not necessarily going to generate, wealth going into this field. And particularly if you live in a major, metropolitan area, there tends to be an overabundance of clinicians.
Yeah. I'm still excited to be a therapist and help people with their mental health, but looking at the price tag, it seems dramatically overpriced. I'm on LPC track, but it's basically the same thing.
Yeah, exactly. Yeah. And look, at the end of the day, I think if you're happy with what you're doing and you feel called to the work, then that's what matters. So, yeah.
And so what's your specialty?
Yeah, so I specialize in ADHD. I have a company called ADHD Dude, and I create free content on a YouTube channel, and I have a podcast as well for parents of kids with ADHD. And my main business is I have a membership site that provides parent training, which is actually the American Academy of Pediatrics recommended treatment for kids with ADHD. It's not therapy, which most professionals don't know. So, yeah, I provide parent training. That's my main thing. And then I do some in-person group stuff for kids as well.
You just dropped a very new piece of information on me. So the primary treatment, I guess you call it, for ADHD in younger people is not therapy.
Correct. Yes. This has actually made me leave several Facebook clinician groups, because when I cite the evidence on this, they tend to get pretty angry. But yeah, the evidence shows that therapy is not what's most effective for kids with ADHD and addressing ADHD-related challenges. It's parent training in conjunction with medication management. Interesting.
Okay, so this parent training, does it look like what you might call contingency management or rewards and punishment type thing?
It's evolved, I'd say, a little past that, depending on who, what program you use, or, your training, or what in my case, what I created based on different, evidence-informed parent training programs. But yeah, it's really about addressing things in the moment and simultaneously helping to teach skills.
Okay. So it seems like there might be two, people you're fighting against. One is kind of mainstream therapy, which says, whatever the problem is, come to us. But the other one is kind of this new wave of TikTok diagnoses. There's so many TikTok influencers telling you, oh, if you like the color green, that's a symptom of ADHD. Just an unlimited number of potential symptoms for different diagnoses. Are you constantly correcting people with bad misinformation?
Well, I'll tell you, I'm not, because in all honesty, my audience on social media tends to be pretty well informed, and the people who like my content tend to be people who are, they're not swayed by their emotions. They want evidence-informed information. I'll say it this way, they just have a lot of common sense. So yeah, they don't really get swayed by the TikTok, pseudoscience stuff. But there is a tremendous amount of that. And, I think the one thing that I try to teach parents is that a lot of the parenting social media content out there, it might make you feel good, it might pander to your emotions, but that doesn't necessarily mean it's going to be helpful to your child.
Mm. Mm. What's something that you think is, sounds good or might feel good, but it's actually detrimental to a kid with ADHD?
Well, I can tell you, I'm going to, instead of what I think, I'm going to share the journey of many of the families who I've worked with over the years, which is most of them, when their child is diagnosed, they are referred to, talk therapy or play therapy, often spending years and thousands of dollars, with a well-meaning therapist who likely does not have any training in ADHD, isn't following any type of evidence-based practices. And they spend years and years, working on coping skills or, trying to get the child to change their behavior. And it just, it doesn't get anywhere because that's not how the ADHD brain works. So, yeah.
That sounds like that could be very disappointing for a lot of people who, thought that they were trusting the experts, and came away with no progress.
Yeah, that's actually a very common narrative amongst the families I work with. So, yeah, I would say it's more common than it is not. So,
yeah. And you also have some background with autism and formerly Asperger's.
Yes, exactly. Yeah. So I was also a school social worker. I worked in special education schools for students who were primarily diagnosed with, what I refer to as higher verbal autism, what we used to call Asperger's. We're at the school because of, behavior challenges, and often there was an accompanying ADHD diagnosis with that as well. So really my whole career for the most part has been spent, in, I guess what we would call now the neurodiverse space, really.
Gotcha. Is there some overlap in terms of, I guess, misinformation, or like does talk therapy work well with the autism crowd, or is it kind of a similar, like, parent coaching is more the route people should take?
Well, look, I think whenever you're working with kids, if there's not a parent component at least 50% of the time or more, then it's not going to be very effective work. That's my thing when we're talking about working with kids. I read a quote recently of a clinician saying, who I really respect, saying, much of child therapy is glorified daycare or babysitting. And I think he's exactly correct about that. Yeah. So because, just seeing a child in therapy and then, bringing in the parent for the last 5 minutes and saying, like, here's what we worked on, or the parent kind of going through the week at the beginning, telling the therapist, everything the child did wrong, that doesn't lead anywhere.
Yeah, it's kind of one of those things that kind of before I got into grad school, you hear like play therapy. Oh, no, this is like very scientific, and then you kind of just look at kids in a sand tray or whatever, and you think, is this all there is to it? What's the deal here?
Yeah.
Yeah. So do you feel like these two areas with the autism, the ADHD, with kids in general, and the therapy profession, do you feel like that's been politicized heavily over the last few years?
Yeah, I say it this way. I've been on social media, or I should say I've had a presence on social media for, I guess, about 6 years now. Before a few things have happened, I'd say. Number one, it seems that everybody is an expert in neurodiversity now. 7 years ago, I used to have local clinicians reach out to me all the time, just wanting my advice, saying, oh, I'm working with this guy with autism, or I'm seeing a kid with ADHD, and people that they should have been seeing them to begin with because they had no specialization in it, but that's another story. But I don't get those people reaching out to me anymore. And I was like, well, why don't they reach out now when I have much more visibility? And I think it's because a lot of clinicians believe that they're experts in this now because there's been, it's been more visible, having neurodevelopmental differences. So on top of that, I've seen really quite an extreme politicization of the I've called the neurodiverse parenting space. And also on top of that, because as you mentioned before with TikTok, we are also seeing a tremendous amount of self-diagnosing on social media. So I'll tell you, last year I did 2 presentations. One was at a very large state university for the clinicians there, in the counseling department. And the other one was for clinicians who worked at a consortium of community colleges. And in both those presentations, different states, I was asked to address the amount of, students who are coming into these counseling centers, self-diagnosing themselves, often with a neurodevelopmental difference such as ADHD or autism. And at the one presentation, there was a neuropsychologist there from their testing clinic, and she shared with me that this had become so common that they nicknamed, these students coming in as TikTok diagnosers. And on top of that, when they would tell them that they didn't have an autism diagnosis, they said some of them get, pretty angry about it and say, you're missing something. Like they want the diagnosis so badly, despite the fact they have no developmental history of autism.
Well, what do you think causes this emotional attachment to these diagnoses that you kind of, self-diagnose based on TikTok videos? Why are people so attached to it?
Yeah, so I think it's a confluence of a few different things. I think there's one group of individuals who, if they had gone through, kind of a, had some mental health treatment, or I'd say quality mental health treatment, somewhere along the line, they might have been diagnosed with, one personality disorder. And I think those individuals, in general, individuals with personality disorders tend to fly under the radar. They tend to not seek out treatment, or that part, that part tends to be missed. So I think for a lot of them, those individuals have watched videos on TikTok or social media of, somebody saying, I have autism and I fly into a rage, or, whatever this is. And they hear these things and they say, oh, this makes sense, right? This is why I'm emotionally dysregulated. This is why I have a history of poor interpersonal relationships. It must be because of autism. It can't be because of something else. So I think it's very easy. People want to understand themselves. So I think when they see something, forget about who it's from, that resonates with them, well, then that provides a very nice, simple package explanation, right? This all has to be because of my ADHD, or this all has to be because of autism. I was just never diagnosed. So there's that group. I think there's, another group who are looking for an identity as part of a marginalized group, which is, I think, a lot of the individuals who are coming into the counseling centers at these, these colleges I mentioned. And I think, that is for them, it's really just consistent with Jonathan Haidt's research, where he looked at and saw that the mental health of young women who identify as liberal or progressive, kind of has sunk the fastest. And why is it sunk the fastest? Well, it's not about, who they voted for president. It's about that they spend the most time on social media, and they spend the most time consuming content that, provides this victim framework for them. He actually refers to it as, or in their book, The Coddling of the American Mind, they refer to it as reverse CBT, meaning that what they're learning on social media teaches the opposite of what cognitive behavior therapy teaches. So I think for those individuals, because they get so sucked into social media, that and the politicized content they watch, that having an identity as part of a marginalized group gives them some, it gives them some meaning in their life. So there's that. And then I think there was a small group who probably flew under the radar and may present with a neurodevelopmental difference or with other mental health challenges, but just were never diagnosed, when they were kids. And their parents never sought out any type of treatment. So
that's interesting. Let's see if we can connect some dots here. In a lot of these spaces, it's almost dismissive if you don't have a diagnosis. You're neurotypical, like you wouldn't understand our club kind of thing. And if you don't have any kind of badge of marginalization or any kind of diagnosis, you're vanilla, you're privileged, it's actually, kind of an inversion. So there's less social capital, you're less interesting as a person. And so a lot of these, like you said, predominantly younger liberal white women are seeking out, like, how can I identify with some of these type of like a neurodevelopmental or neurodivergent diagnosis, and that's creating this reverse cognitive behavioral therapy. Because in CBT you would try to downplay negative issues in your life, but now you have to elevate them, because the more these issues are elevated, the more like meaning and purpose you have, and the more social capital you have as a victim. So this whole thing is kind of going opposite to what you would want as a therapist.
Yeah. And I think the other part is, I think a lot of these individuals are looking for a community. And, if you come in and just say, like, hi, I want to be supportive of you, well, that's not really going to get you too far. But if you say, hi, I have autism, I self-diagnosed myself, or, a lived experience person with, an autistic person diagnosed me, well, then you have credibility, right? And then you are automatically accepted into this group, and I think particularly for young people who spend a profound amount of time on social media, isolated from their communities and from, peers, this becomes their community, and it's toxic in my opinion. It's toxic for their mental health, I should say.
I'm wondering if you see any kind of like similarly to how you might see with college students, but with parents of their kids, like some kind of almost pride, like my son or daughter is autistic or ADHD. Like, they're not just a vanilla kid, they have a diagnosis. Is there any of that mentality you're seeing?
Yeah, I mean, I've always seen that since I've been on social media of people creating, online identities based on their child's diagnosis. And, that to me was just kind of whatever. I didn't pay attention to that. But one of the things now that I see, and it's interesting because what I see with parents who would identify as progressive is very similar to what I see with many clinicians, which is this, strong desire for allyship with who they consider to be marginalized groups. So, for instance, there is a segment of, parents who believe I'm not listening to, professionals. I'm listening to lived experience people, right, who self-identify, as having autism, right? Because I think their desire for allyship takes precedence over any kind of evidence, right, or facts or anything like that. And where this really, I'll tell you, you might probably are not familiar with this, but there's a term called pathological demand avoidance. Now, I've been was in the autism field a long time, went to many autism conferences, tons of training in autism. This was a very obscure term in the autism field, 6 years ago. It then became, because of social media, this self-diagnosing trend of parents self-diagnosing their children with this pathological demand avoidance. And then on top of that, many created an identity for themselves based on it. So pathological demand avoidance was a term used to describe a profile of autism of people who tend to avoid things, okay? Now, a demand avoidance is extremely common in people with autism. When I first heard it, I'm like, this is just part of autism. Why does this need to have its own term? It's also very common in people with ADHD. So what's happened is it became, kind of went from being this proposed subtype of autism to, this so-called diagnosis. And now it's developed into an ideology. And in this ideology, and let me use the biggest, person in this space on social media, they have the fastest growing social media account I have ever seen. And they have no clinical background. They have no professional experience. They have a doctorate in political science, and they use doctor in their name to kind of sound like they have some credibility, even though it's not in a related field. And they, basically say, I take direction from people with autism with lived experience. And what they teach parents is the most extreme form of parental accommodation, meaning that you accommodate your child's inflexibility, you accommodate their emotional dysregulation, and so on. And that completely contradicts the research data. What we know is parental accommodation, which is when parents change their behavior to alleviate or avoid their child's temporary distress, that makes behaviors worse. It makes anxiety worse, but this, this is what's being pushed in this, pathological demand avoidance ideology is the most extreme form of parental accommodation. And it's presented as being compassionate and, quote, neurodiverse affirming, So that was a long-winded way of answering your question, but things have gotten out of control. And I'll tell you, whenever I've posted some evidence of this, I get bullied online, because it's basically become a parenting cult of people who need to believe that their child has this diagnosis, and they rationalize, their child's behaviors through this lens that has no evidence-based treatments, has no standardized diagnostic tools, and is not a recognized diagnosis anywhere in the world, even though they like to say it is. So, yeah.
Wow. So you talked about lived experience and across, academic disciplines that are, infected with social justice, and especially the therapy profession, lived experience seems like the mentality seems like it reflects a higher truth than fact. that fact in, evidence-based treatment is a lower level of truth compared to the truth of lived experience. It seems like we're seeing that broadly across a lot of disciplines. How do you make out that lived experience phenomenon?
Well, I think what you just described is completely accurate. And I would also attribute it to, again, I think for clinicians, it's so important for them to feel compassionate that they, and they see this allyship towards lived experience as taking precedence over anything else, right? Because if they say, well, you know what, maybe the evidence on this or the, 3 generations or, 30 years of studies that have been on have a little more credibility than the subjective experience of an individual. Well, then I think in their mind, they often think that's oppressing the individual, right? That I'm silencing them. And I've had colleagues say to me, when they've kind of been bullied online and had somebody say to them, you're silencing autistic voices or something like that, they're reactive to that, right? Because they feel like, oh, I don't want to be like silencing anybody. I don't want to be oppressive. And because they don't really see kind of the bigger picture of where this is coming from, I think, so yeah.
My work background is in alcohol and addiction treatment, and it's most people seem to think it's pretty obvious that if a heroin addict says, I want to do heroin because it's good for me, that's not a factually true statement. This person is under delusion. And if you affirm that delusion, you're going to be facilitating this person hurting themselves. Like that seems like a very, straightforward scenario that most people could get on board with. But there's other areas where, if you're not affirming their truth, then somehow like you're oppressing them, you're marginalizing them. How do you break through that mindset?
Ryan, my thing is, I don't think there is any breaking through to be done. I think the best thing that we can do as clinicians is just ground people in reality. And what I mean by that is not in the therapy room, but looking at, do they have real life connections? Are they connected to their community? Who is in their life outside of their virtual life, right? That has some, meaning to them, and who they connect with. Because I think so much of what we're talking about here is a result of disconnection and people feeling disconnected. So, on top of that, I think there is a point to be made that, that we need to really have, need to have honest discussions about the fact that many clinicians today are just affirming whatever kind of distorted thinking or delusional thinking that their clients have. And again, I think a lot of that is done with the intention of being compassionate and with being an ally. And I don't know where this shift happened, where that became okay to do that, to your point of like, if somebody says, I feel like using, we don't affirm them and say, okay, I hear you feel like using. Maybe that would be a good choice right now because this is your identity as an addict. We would never do that. That would be insanity. But we're doing that when a young person comes into a therapist's office and says, I identify as a Therian. Do you know what I mean? And, I have a saying that I think the child, and I can only speak about the child and adolescent mental health field because that's the world I've been in my entire career. I think it is right on the verge of losing all credibility, in many ways. And when I say losing all credibility, I don't mean in academia. I mean with parents, because of this craziness.
Really? Can you expand on that?
Well, I think, enough, parents I've heard from have had their kids, go to treatment and either, there's no communication with the parents or, it's, they're an adult under the mental health law, so I can't share anything with you. Parents are not part of treatment. And it's a lot of affirming, identities or like, as we know, adolescents need to try on different identities. That's part of being a teenager, right? Well, when you affirm every identity a teenager is trying on, whether that's a trans identity, whether that's an autistic identity, whether it's something completely different, and not question anything, that's a problem, because we're not grounding young people in reality. And if you're not grounding young people in reality, then where is their right foundation? Where does that come from? And I have seen so many well-meaning parents who want to trust clinicians, and then they find that, some, a clinician has been, affirming their child's whatever identity. And they don't know about this, and this is happening behind their back. And, again, if, the parents are who keep kids grounded in reality. And, I just want to share this with you real quick, because I think this is a good analogy. Maybe about 2 years ago, in a local Facebook therapist group, a clinician shared a flyer. They were doing an LGBT support group for middle schoolers. Okay. Now, what they said and what they put in the post is, you'll see that this flyer does not have what the group is about. So they left the LGBT off of the flyer. They said, so this way, you can share it with, you can tell the kid about it, but, their parents don't have to know. Right. And by the way, this was a private therapy practice charging. Okay. This was not, some community mental health clinic offering a free support group. Okay. And I posted about this on social media, and some of the feedback I got was, well, that's good that they're doing that, because, what if their parents are abusive, and this whole kind of progressive idea that somehow the clinician, right, the progressive clinician knows better than the parents of what's best for a child. It's, it's a little bit, I'll use the term paternalistic, right? Like, I know better than you because I'm the clinician, right? And where did this idea come from that parents are going to be abusive because maybe, they don't like that, or they're going to oppress their child or hurt them because maybe they don't agree with their identity that they're, trying on. And that's why I think that this field is in serious trouble.
Yeah, I mean, I've heard some version of that a number of times where, it's okay to lie to parents or hide things from parents because, I mean, they're probably abusive behind closed doors. It's just, it's an absurd argument. And it feels like not just with kids and adolescents, but the therapy, helping profession, mental health field is losing legitimacy as a whole. It feels like it's losing legitimacy rapidly. Do you see that as well?
I have to say, on a day-to-day basis, I'm pretty out of touch with the mental health field. And part of that is by choice, I should mention. I definitely feel in the, child and adolescent mental health space it is, and that's why I keep my distance from it, to be perfectly honest. I have my, colleagues who I think do good work and have integrity. And I just kind of stick to them. And I think what I'm most concerned about is this new generation of clinicians coming up who seem like they have been trained as activists first and clinicians second.
Yeah, I mean, I'm right in the middle of that. So yeah, I just finished all my courses for grad school, and I start my practicum in a few days. I'm very well aware of, from my perspective of what it looks like where social justice is first, and if we get around to it later on, we might attend to some clients. What are you seeing with new clinicians you see coming out of grad school?
To be perfectly honest, I stay away from them. What I see with new clinicians is what I'm hearing secondhand or what I'm seeing in, clinician Facebook groups where they're asking questions like, how do I support my client who's a Therian, and where do I help them get costumes and things like that, So I just tend to stay away from it because, to be honest, Ryan, I really, at this point, I don't want any part of this field the way it's going right now. I hope at some point that changes. And I will say, I shouldn't say I don't want any part of this field, because I want to acknowledge there's lots of people doing great work and evidence-based work. And there's, new directions that I want to grow in and learn in. So, for example, I'm really focusing on a lot on social anxiety, because social anxiety in boys is something that goes, really undiagnosed. And I primarily work with boys. That's always kind of been my population. I'm also interested in learning more about what we would call, muscle dysmorphia, which is a form of body dysmorphia. And I think that's going to be a really growing field because, I see, particularly on Reddit, how many, young guys have this very distorted body image. So, that's something I want to get into. One of the things, and I hate to say this, but I'm going to, if I'm going to be truthful, is I think one of the big problems is that particularly master's level clinicians tend not to read. And when I say tend not to read, they tend not to read research and they tend not to read evidence. And I find that the people in the field who I respect, and, I have my master's, I am not an elitist about education, but the people in the field who I tend to respect tend to be doctoral level clinicians or master's level clinicians who I know have really done their homework and do a lot of reading, and get really, excellent training. And I don't think that most clinicians do that.
Wow, it was a lot to unpack there. I want to talk about one thing that you highlighted, working with younger men. And this is something I like to bring up with especially male clinicians. is men are much less likely to come to therapy than women, much less likely to become therapists than women. Men have some unique needs and issues that could be addressed in therapy. And a lot of times men are scared away. And I think some of that is due to, maybe inaccurate stigma around therapy. But some of it is due to, I think there's this feeling in the field where as a man, your primary problem is you need to acknowledge your privilege and tone down your masculinity. I feel, is there some holes where we're missing where we could serve men better?
Well, let me ask you this. In your training, because I graduated from grad school in 98, so I've been out of school a long time. Have you had any classes on working with men effectively?
None.
Okay, either did I. And good luck finding one in any graduate program, right? I think one of the things that we need to acknowledge is, I have a saying in just my own little field. I say therapy was not designed for boys, and it absolutely was not designed for boys with ADHD. The child and adolescent mental health field is 90% female, and that number is growing. It's not getting better. So is that a problem in itself? No, but what is a problem is that we completely ignore the needs of boys and men. And there is this expectation that their brain should work exactly like adult females, and they should be able to, verbally express their emotions and benefit from therapy the same way that an adult female would. And I think right there is the genesis of the problem is that therapy, it does not acknowledge that boys and men have different, the mental health field doesn't acknowledge that boys and men have different needs, and on top of that, I also think there's a very anti-male bias in the field. Back in, I think it was 2019, the APA came out with guidelines for working with boys and men. And, if you want to talk about something that was, ideologically captured as a document, it was that. I mean, it was extremely negative.
Yeah.
So yeah, there's a tremendous problem in this field with this, which is one of my main concerns because, as we know, boys and men are not doing so well right now.
Yeah. I mean, there's a huge problem with younger men. It seems like, I do, have historically in the addiction field worked with quite a few younger men, and it seems to be this really tough dichotomy that they run into, where on one side it's this very emasculated vision presented by feminism, where it's like, just kind of become like another type of woman over here, and on the other side you've got this very kind of chest thumping Andrew Tate vision. And a lot of men are very confused as to what actual masculinity looks like. How are you guiding younger men in that minefield?
Yeah. Well, I'll tell you, in my work that I do with kids, I tend to stay away. I don't want to say I stay away from this, but I tend to stay away from the politicization of it because obviously I don't want to, touch this. I think really the best thing we can do is just model it and talk about that, for instance, like on, Sunday when I have my, group, I have a middle school group and a high school group, and when we talk about social anxiety and we talk about, how do guys form friendships and keep friendships and what do other guys need from you? I think to just talk about this in a very matter-of-fact way and not start from this premise of, men are toxic and they can't talk about their feelings, right? And you're going to be different because you're going to be able to verbally express feeling words, I think that we just we do it by modeling it, I think is the answer.
How does social anxiety manifest differently in younger men compared to women, and why are we not catching it as well?
Yeah, I don't even think it necessarily manifests differently. I think that, at least for kids that, we don't really talk about it. We don't teach kids about it. So they don't have a frame of reference for understanding what it is. So like for, it's, anxiety in general is very common with ADHD. 30% of individuals with ADHD also meet the criteria for an anxiety diagnosis. Often it's more mild, but, for the kids I work with who have ADHD and social anxiety, nobody's ever explained this to them. So they have no context for understanding it. So they often think they're the only one in the world who feels this way. And my thing is, when we can get, a group of boys or men together and be able to talk about this, and help destigmatize it and help them feel like I'm not the only one, I think that's what's most important. And that's why I will only do groups with kids. I don't do individual, because I think particularly for boys and for young men, having a shared experience of seeing other guys their age who can, show some vulnerability, and it doesn't have to be dramatic vulnerability, right? It can just be like, yeah, I feel anxious sometimes. I think that's really powerful.
Yeah, that's. Can you explain to me or what the connection is between anxiety and ADHD? Why do those go together?
Yeah, well, we're not completely sure is the honest answer. People with ADHD tend to have more difficulty regulating their emotions, and emotional regulation and what's called response, inhibition. Those are part of what's called executive functioning, which I refer to as the operating system for the brain. So likely that is one reason why, but yeah, we're not 100% positive why there is this correlation between people with ADHD and anxiety at this point.
Gotcha. Okay. What are some things that younger men, you talked about junior high, high school, can do to improve that improve executive functioning?
Yeah. So, what ADHD is a very misleading name. ADHD stands for attention deficit hyperactivity disorder. What ADHD actually is what I call it's an executive function developmental delay, meaning the prefrontal cortex, the part of the brain that controls executive functioning, is developing approximately 2 to 3 years behind their same age peers who do not have ADHD. So that doesn't mean that, if we talk about, the frontal lobe being finished developing around, 26, 27, where somebody with ADHD, it might be closer to, 28, 29, 30. So what happens is when somebody has ADHD, those executive function skills develop, slower, they're slower to finish developing. But when they finish developing, they might not be optimal as well. So what we know, what the evidence shows is helpful is, number one, again, parent training and what we call executive skills coaching or executive function coaching. Often it's referred to as ADHD coaching. So that's what the evidence shows is helpful with this. But, for kids, the parent part is most critical because parents have to create scaffolding around kids. But for teens and for young adults, if they have some motivation to participate in coaching, that can be really helpful. That being said, I always want people to understand that just like there's a quality control issue in the mental health field, there's a quality control issue in the coaching field because coaching is an unlicensed, unregulated field. So anybody can and does call themselves a coach, particularly an ADHD coach. And much ADHD coaching does not go beyond, helping students learn how to organize school materials. And that's not what real executive function treatment is.
Do you feel like the coaching field generally, like life coaching, is I don't want to say scammy, but kind of misleads people into like attracting them into something that's not actually helpful for them?
I would say, having as long as I've been in this field, I would say no more so than the mental health field.
Wow. So having a master's level degree is no more of a protection from that compared to, no barrier to entry.
Not in my experience. No.
Wow.
I mean, do I think there's, and again, I'm in kind of a smaller world of coaches who tend to be, more dedicated to what they're doing because they have a narrow focus and I think are genuinely altruistic people who really want to be helpful. They just don't know what they don't know. That's a little different than, the coaches out there who, 1 week they're, a coach for women. The next week, they're, an ayahuasca coach or whatever, right? The next week they're a trauma coach, whatever seems to be the trend of the week. But yeah, again, I don't look at coaches as, any less credible than many clinicians out there based on my experience.
What do you think of therapists, social media influencers? Because there's people that I follow where like everything they post, I'm like, dang, that was some really good, solid advice, and there's just some off the wall people. It seems like the title therapist doesn't really tell me a whole lot.
Yeah. Well, I think kind of my barometer of looking at that is, how immersed are they in critical social justice culture? Are they kind of their content focused on that? Are they focused on pandering to people's emotions, and talking about, if you hurt your toe, it's because, your mother never coddled you when you were younger, or are they providing some evidence of things? And that's what I look for. I look at, can this person cite research? Are they citing evidence? Do they have sufficient training in something? And that's how I look at somebody who's posting content on social media.
It really, from my perspective, seems like there's an inverse correlation between ability to cite evidence-based research and commitment to critical social justice. Do you see that?
Oh, yeah, absolutely. Yeah, no question.
Yeah, it's almost like that worldview is it's not just neutral to the idea of evidence, but like the whole concept of evidence is kind of offensive in and of itself. It seems like.
Well, I think they see it as that, in this, everything through critical social justice culture is binary, right? Things are one way or the other. So I think for many clinicians of the type we're talking about, it's kind of like, well, evidence that, that is oppressing lived experience. I think that they have such this rigid view that they can only see the world in black and white terms like that. So, yeah.
Do you think we've passed peak woke?
Not at all. No.
Really? Okay. Can you touch on
not.
that?
And it's funny. I think when I hear about this, and I listened to quite a lot about this. Obviously, that's how I found you. No, I think that this is going to last for generations. I do. Yeah, and I think for people to think that oh, it's passed now. Whether that's because of the recent presidential election or we're moving past it. No, absolutely not. There's a young woman who has a writer in the UK. Her name's Freya India. And she has some really excellent pieces about this where she talks about, what she's a young woman and she talks about what she sees as the indoctrination of young women into critical social justice culture. And, if somebody this is what they're being taught at a young age, when we're young, that tends to form our, views and our values. And I don't want to misquote her because she does such a beautiful job articulating this, but her take on it is basically that, this is not going away anytime in the near future, as long as there are pathways to teaching young people, critical social justice culture, right? And this binary worldview. And that, if you don't buy into this, then somehow you're not a compassionate person and you're a bad person. So
yeah,
I think we have several decades before.
Yeah, that's really discouraging. I think again, I don't know where exactly this is going, but from what I see from my perspective, is the election told us that numerically, most people are over this, in a lot of ways. They're just not really putting up with it anymore. The thing is, the true believers are all in positions of power. They're university professors, administrators, they're running nonprofits, they're running HR departments in corporate America. And, you cannot pry that power out of their hands. Like they're doing this as if they have the zeal of a kind of religious fanaticism. This is not, a disagreement over best practices over how to handle a certain client. This is like an existential battle between good and evil, the way they look at it. And, I honestly don't see how you resolve that. How does this, is it just going to be ugly for decades? Like, how do you resolve that?
Yeah, that's a great question. I personally don't think there's anything to resolve, because, look, do we want to spend our time and energy focused on a culture war? Or, as clinicians, I think, do we want to more, help ground people in reality and help them get to a better place in their life? And I think part of me feels, as much as I pay attention to this stuff just because of my own interest, at the end of the day, I think I've accepted this is not going anywhere, and I can only do what I do on a daily basis. And, and know that there are kindred spirits such as yourself out there who feel the same way as I do. And I know that there's people doing good work. And I hope that, I think really the main thing I hope for is that more people such as yourself begin to feel comfortable, speaking out on social media or, and have a public platform where they can share their views, because this is the only way this is going to, I think more people are going to feel connected is by realizing, what, maybe this is what I was taught in grad school or what I was taught in undergrad, but this doesn't resonate with me, or I don't like the way that, my, relatives who don't have a college degree or, kind of condescended, by, these academic elites. Do you know what I mean? So I think what I'm trying to say in a roundabout way is, I think just taking a more humanistic approach where we connect in person and know that there's other people who, feel the same way we do. And even if we have to find each other through social media, that's fine. But I think getting back to real life in-person connections and feeling connected to people in our community is what's going to, help with this.
I like that. Have you experienced, you present a piece of research or an argument for something clinical, and someone says essentially that is illegitimate because you're a white man?
Well, I would say maybe not in those words, but I certainly get that sentiment quite a lot. Yeah. I'll tell you what's interesting I have found is, I have a, sizable following on social media. When I get negative comments, I will tell you that probably 80% of them are from younger white women in the UK, primarily, followed a little bit maybe by Australia and a little bit by here. What I get the most pushback about is what I mentioned earlier about the pathological demand avoidance from, these parents who have made themselves believe and created this narrative that their child has this diagnosis and that they are somehow being compassionate towards their child. So obviously, if I'm citing, a piece of research that contradicts that, that feels threatening to them, thus they attack me. But for the most part, I would say, yeah, I think it's more, look, I'm a male in a pretty much a completely female space. I'm an outspoken white male, cisgender white male in a completely, female space. So I think there's obviously some anti-white bias to begin with. There's some anti-male bias, and even though, I'm gay, it's not part of my identity. I don't make it part of my identity. So therefore, I don't have that little piece of credibility to kind of win them over, because I don't make that, an issue. So yeah,
your one shield that you could use, you don't use it.
One shield I don't use. Yeah, not part of my identity. So yeah, but look, I think at the end of the day, Ryan, you know what? People, at least for me, I find that people who follow me on social media, they're very appreciative. And I think the bottom line is that I'm providing them with information that's helpful to their family. And I think the color of my skin, my gender identity, my sexual orientation, I don't think it matters to people if they know that you are genuinely helping them,
Yeah.
And I will tell you something interesting real quick that I have noticed over the years. A lot of the people who tend to follow me, I don't want to say everybody, because I'm not doing a poll about this, but I find that I think my content, and I'm proud to say this, I think it tends to be a little more inclusive than some other people, meaning that I have a lot of people of faith who follow me on social media. I think I probably have more people of color, maybe, who identify as, moderate or even right of center. Because, I don't tell people what their values should be, or I don't tell them, what values they should teach their kids. What I teach them is, this is what you're dealing with. Here's, the evidence shows of dealing with it. Here's what I've learned in my experience parenting, a child with a neurodevelopmental difference. And that's kind of it. So.
It's kind of interesting you say that. In my grad program, you hear the word diversity a dozen times every time you step on campus, and the program is probably 80% white women. You don't necessarily live or practice what you preach. That's interesting that you kind of focus on where is the evidence? What actually works? We're trying to relieve distress in people. We're actually trying to help people, and by focusing on that, the diversity piece kind of works itself out. And that's something that I feel like in kind of a broader sense gives me a little bit of hope for therapy. If you have a therapist who's, their primary focus is making sure they get pronouns right and, making sure, you have an intersectional understanding of the world, and you have another one who's doing evidence-based practice, who's going to get better faster? Word's going to get out. Eventually, people want to get better. People only virtue signal for so long. Eventually, they don't want to be in distress. They don't want to hurt. They don't want to be in depression, anxiety, whatever these symptoms are. I feel like what you're talking about with evidence-based practice is what's going to eventually get us past this.
No, I hope so. I hope you're right. I just want to mention something to you real quick about what you said. So I didn't mention to you, I started off at a different grad program than where I finished. I started off grad school at Barry University in Miami in their MSW program. And for those folks who are watching and not, familiar with South Florida, the Miami area, it's incredibly multicultural. So I went to this program, that was incredibly diverse for an MSW program. And that was really exciting to me because, coming from Philadelphia, I had never been around Cuban people. I had never been around people from the Caribbean. And the discussions in class were great because it was really people from diverse backgrounds and everyone was respectful of each other. And there was no kind of sense of this critical social justice culture whatsoever. And it was a great experience. The professors were great. So I decided after the first year, you know what, I'm not going to stay in Miami. I should finish up school in Philadelphia because that's where I'm going to live. I should make connections there, and do my practicum there because I did, practicum during the school year. So I decided for my second year to finish at Bryn Mawr College School of Social Work. That was a mistake. So when I got to Bryn Mawr, completely different environment than Barry. Bryn Mawr was primarily white, primarily, I'd say upper middle class, whereas at Barry, the students came from much more diverse backgrounds, not just ethnically, racially, but also financially. So I went from this really wonderful environment to this environment where I learned very quickly that your credibility in class discussions was based on, number one, how many marginalized identities can you check off? That was one thing, which wasn't for most people, because it was 90% white women, I think, in the program. But the other one was, how much can you disparage white men in particular, right, and white people as being oppressors? And, basically, all my, class discussions at Bryn Mawr felt that it was about how white men are oppressive. I felt like I learned no clinical skills there. I didn't gain anything from the program that I used in practice, or even kind of developed a good clinical foundation there. And in hindsight, I absolutely wish that I would have stayed at Barry. So I say this because, I want people to hear this was 26 years ago that this was my experience. So I can't imagine what it's like now. There was no talk about wokeness or critical social justice 26 years ago. I was experiencing it, but there was no language to go along with it. Wow. So yeah.
Wow, that's fascinating. The whole obsession with white men, a lot of times in my program, it almost feels like a get out of jail free card, like if you didn't read the material. I remember there's this one time in class, the professor asked something, what was Carl Jung's position on the anima and the animus, something like that. And this woman goes, well, I think it's important to remember that, he was a white man, and, it's like basically like, none of this is legitimate. I don't have to have any opinion on the text that I didn't read, because I can just say the words white man, and it's like waving a magic wand. Like, it all goes away, basically.
Right, exactly.
You went to Bryn Mawr, and I don't know if there was a couple of years ago that big, basically activists took over campus. I don't know if you heard about that.
I just heard about this last week, actually.
Yeah, I mean, the stuff they were demanding was so wild, like demanding that the university recognize non-binary trauma, and just a crazy list of demands.
Yeah. And you know what, Ryan, I think one of the things we should also acknowledge is, well, first of all, Bryn Mawr College undergrad is separate than the graduate schools of the graduate programs, like the School of Social Work. The undergrad is all women. Grad programs are not or are co-ed. I grew up down the street from Bryn Mawr College, I should mention. Bryn Mawr College is basically, young people from very privileged backgrounds, many of whom went to very expensive private schools or were at the top of their class in public schools. But again, you're not really finding, students from Philadelphia 20 minutes away going to Bryn Mawr. Okay. I went to Temple University in Philadelphia. The kids who grow up in Philadelphia, if they're first generation college students, they tend to go to Temple, or they go to Penn State or one of the state universities. They're not going to Bryn Mawr. So, and when we talk about like this, this thing you're talking about that I just heard about last week, it's very consistent with what we see, at Columbia or these other schools with, their pro-Hamas protests. It's upper middle class students who have a lot of time on their hands and don't seem to need to work, right, to supplement their income or their education because it's being funded for them. So
hey, that's interesting. There was a strong correlation between tuition price of a university and number of protests. So Harvard, Yale, Columbia, just constant protests, almost non-existent at community college. It was very tied to privilege.
Yeah. I used to live, right down the street from the University of Arizona, and I can tell you, if there was any kind of protest there, it would be like 5 students. The kids there have better things to do with their time.
Yeah,
they're working for time. They're going to school. Yeah.
So, I've got 2 questions left for you. The first one is, how do we fix the mental health profession? That's a broad question.
Well, I would like to say that we fix it by starting at where the training is happening. But I don't know how that's supposed to happen when I really do believe that these institutions are truly ideologically captured. As much as that term has become a cliche, I think it's accurate. So I don't know how we fix it, because if we're not starting at the foundation of this, because I think that's absolutely where it needs to start. I think the only other thing we can do is, bring awareness to organizations. I don't know if you're familiar with like Open Therapy Institute. Yeah. To bring awareness to organizations like them who are looking to get the, socio-political bias out of treatment, and are providing trainings for people who want, a non-ideological training, in working with different populations. I think that's really important. And I think those are that's really the best thing for right now. It's just supporting organizations who, who want politics out of treatment.
Nice. Final question is, what is something just generally in society that we're not talking about that we should be talking about?
Yeah. I would, for me, it would be, how do we start really addressing, the mental health needs of boys and men in an actionable way that's going to make some kind of impact. I think that's what it would be. And, one of the things I'll just end with this is, this past administration who's about to go out, they were presented with the opportunity to, have a, I forgot what it was called, but, an organization, a government organization focusing on the needs of, boys and men, as well as girls and women. And what they opted for was completely to just write boys and men out of that and just focus on girls and women. And I think, if things are going to have to change at, a policy level, but also just by doing some grassroots work and saying, hey, I want to make the work I'm doing on a daily basis somehow more inclusive, and reaching out to these individuals who typically, as we said, would never seek out treatment. Because how else are we going to help them, when they're not seeking out treatment and in fact they're resistant to it? So, yeah.
It seems like caring about men at all, or saying that men matter, that in and of itself is kind of a social taboo. Like, well, they're the oppressors, they're the privileged ones. You shouldn't even acknowledge them in that sense.
Well, caring about this has been coded as a right-wing issue.
Yeah.
Right. So therefore, yeah, it's automatically taboo.
Yeah. That's
or somehow you're neglecting the needs of girls and women if you care about, if we're trying to have some kind of equality. Right.
Yeah. That's very unfortunate.
Yeah.
Well, thank you so much for joining me, Ryan. Really loved our conversation. If you'll hang out for just a second until we finish uploading, I loved having you on and enjoyed the talk.
Yeah, it was great talking to you. Thank you so much for having me.